Thanks so much, ILSI, for having me, and for Connie for organizing the session, and really appreciate the flexibility with my travel issues. So I'm so glad to be here and learn from all of you. This has already been a fabulous session today. So I'm going to talk about Healthy People 2030, just the overall vision and mission of Healthy People. The vision is a society in which people can achieve their full potential of health and well-being across the lifespan. The mission is to promote, strengthen, and evaluate the US's efforts to improve health and well-being across our country. So I think many of you probably know, but it's updated every 10 years. So I'll give a little bit of history, but now we're looking forward to Healthy People 2030. So all of the goals are looking forward to them. So Healthy People 2030, it provides a framework for a prevention agenda, and it communicates a vision for improving health and health equity. So what is Healthy People 2030? It's a public health program. It's administered by the Department of Health and Human Services. It's a collaboration with federal and state agencies. It was established in 1976 by Congress. So it identifies topics that are public health priorities in the US, and it establishes national science-based measurable objectives. And that's key, it has to be measurable. It sets targets to be achieved by the end of the decade and tracks data-driven outcomes. So we monitor progress, and it motivates, guides, and focuses action in the US. It also offers a model for international, state, and local planning. So quick snapshot of the evolution. So we started off in 1990 with 200 objectives, moving on to Healthy People 2000 with 300. You can see in 2010 it exploded, and how this works is that we work with all of our federal agencies, and we also have an advisory committee that advises on objectives. So as you can imagine, people are like, we need an objective on this, we need to measure this, and it gets really big. In 2020, we were up to 1,300. And then I think this last round of updating, someone was like, okay, we need to like slim this down a bit. So 23 was really refined to 355 objectives. So the focus of 2030, we've always been interested in health equity and reducing health disparities, but there's been even a more emphasis this round on improving health equity. So we have a new model for social determinants of health, which is, I think a lot of you know, conditions or environments where people born, live, learn, work, play that affect a wide range of their health, functioning, quality of life outcomes. So as you can see here, these are the main parts of the social determinants of health. And if you go to the Healthy People website, you can actually use this graphic and read more about it. But education, access, and quality, healthcare, access and quality, neighborhood and built environment, social and community context, and economic stability. So basically what we're trying to say is that for all of our objectives, a lot of them really depend on like SDOH. We can't just say like eat healthier or go be active or have better lung function, but a lot of them depend on these social determinants, which those are underlying issues that we have in the United States, and I'm sure across the world, that need to be dealt with. So we have leading health indicators. So we have, as I mentioned, 355 objectives, but we also have leading health indicators, which are a small subset of high priority Healthy People 2030 objectives. So most of these factors are major causes of death in the US. And they help organizations and communities and states kind of focus their resources. So I'm going to show you what the leading health indicators are in the nutrition and weight status category. So these are all of the nutrition and weight status objectives in 2030. You can see we have some for the general population, some for people 2 and older, and then we have one for 1 to 2, and then a specific one for females 12 to 49. So the ones circled in green are the leading health indicators for this round of Healthy People. So I'm going to highlight those. So starting off with reduced household food insecurity and hunger. And I think we all know this is a major issue right now. I mean, the current administration of our federal government's really focused on this. We have an upcoming White House conference that's going to focus on hunger and better nutrition. So I think it goes without saying that food insecurity has negative impact on all of our health. So for healthy people, we have baseline. So for every round, so we're looking forward to 2030, we have a baseline data and then the target. So you can see here on the slide that the most recent data was that 11.1% of the families or population were food insecure, and the target is 6%. And if you look on the website, if you want more information on how these targets are decided, there's like a whole write-up and all the really interesting data. It's not possible for me to get into in my 25 minutes. So the second leading health indicator is reduced proportion of children with obesity. And I think we've all struggled with this across the world. I think we all know it increases risk for health problems, etc. They're more likely to be bullied. Really, I mean, from research, it's shown that intensive behavioral programs that use one or more strategy can help reduce, and that's actually for weight loss, that's not for prevention. We're hoping that policy and school curriculum changes can make it easier for children to eat healthy and be more physically active. I think all of you probably know that physical activity isn't required, so that's a struggle. So the most recent data from 2013 to 2016 was 17.8% children and adolescents in the US were obese. We actually had the NHANES 17-18 data come out, and it's higher. And I think even after that, we had some like pandemic levels that it's really not looking good. So it's unfortunately getting worse, and we need help in this area. So reduce consumption of added sugars by people 2 and above. So this is a major issue with the data that we have. I mean, eating too many added sugars in food and drink really make it hard to get your nutrient-dense, healthy calories. It's related to tooth decay, obesity. I think you all know this. So we're happy that added sugars is now on the label, so consumers can be more informed. Just showing a little bit of data. This is from the dietary guidelines data analysis. So these are the top sources of intake of added sugars from 1 and above. So as you can see, sugar sweetened beverages is 24% of the added sugar calories, and that doesn't include coffee and tea. So coffee and tea is 11, desserts and sweet snacks, etc. So now I'm going to give, let me see how much time I have, a snippet of some of the federal efforts that we have to improve healthy people goals. We have an uphill climb. So dietary guidelines for Americans is the nutrition policy in the United States that informs federal food and nutrition programs. So about the dietary guidelines, it provides science-based advice on what to eat and drink to help reduce risk of chronic disease and meet nutrient needs. It's the cornerstone of federal nutrition programs. It's mandated to reflect preponderance of scientific evidence, and is targeted to professionals who work with the general public and also anyone who's implementing community programs. And I'll just give a shout out. We have a call for nominations now for our future 2025 advisory committee. So specifically for our US colleagues, if anyone's interested, the call for nominations for our advisory committee is open till July 15th. Put that plug out there. So just to show the 4 main top line guidelines from the last guideline, I mean, these are pretty straightforward. Most people don't argue with these. Follow a healthy dietary pattern at every life stage. So this was the first guideline to go from birth all the way to older adulthood. So we added in the 0 to 2. Customize and enjoy nutrient-dense foods, beverage choices to reflect personal preferences and cultural traditions, and budgetary considerations. So we consider this our like early stage precision nutrition, like dietary guidelines are not one size fits all. It's, adaptable. It's a framework. We want communities, people, and family to use it and adapt it. Focus on meeting food group and nutrient needs with beverages and foods, and stay within calorie limits. And finally, limit foods and beverages higher in added sugar, saturated fat, sodium, and limit alcoholic beverages. So just a few federal programs that implement the dietary guidelines. One great project you've probably heard of is the CDC Food Service Guidelines for Federal Facilities. This is led by the Healthy Food Environments team, but they actually collaborate all across the government on this project. So they turn science into practice, so it's based on the dietary guidelines, but they also make it much broader. So it includes standards on food and nutrition, facility efficiency, environmental support, community development, food safety, and behavioral design. So the last version was based on the 2015 dietary guidelines, but they're actually updating it to have a new version. So the goals are to make healthier foods and beverages available where people work, environmentally responsible practices, and communities are supported through local food sourcing. So just to share, there's a Food Service Guidelines Local Action Network, and that was a partnership with NACCHO, and you can go online and check it out. But these are some of the settings. So it's the guidelines were made for federal facilities, but they're really trying to encourage that these be implemented much wider. So as you can see, federal, state, local facilities, hospitals, healthcare, college, universities, work sites, stadiums, etc. And just one note that I didn't have on the slide, but I wanted to mention, one thing that CDC is really trying to, hopefully, they're trying to encourage is healthier procurement. So it's almost like school foods, that if you require that these foods have to have these certain standards, then healthier foods will have to be available from companies for those facilities. So just sharing what FDA has been doing. I think a lot of you may know some of this, but pretty exciting stuff. So they have an updated food label with added sugar. All of the menu boards, across the US, menus have calories and nutrients, and I find that very helpful. It's also very shocking. So, and they also have a big consumer education on the nutrition facts label that's been really well received. Oops, sorry about the pictures covering up the bottom slide. So this has been years in the making. FDA has worked on voluntary sodium reduction targets. So these are out, and they've put them out for public comment and released the final voluntary. So I think most of us know that most sodium is already in the food. It's difficult to meet recommended sodium intake with our current food supply. So they've been working really hard, with input of industry and health folks on this. So this is their approach. It's voluntary, iterative, starting off with short-term 2.5-year target for 163 categories of food. And they've carefully considered the role of sodium. I mean, they've done public comments, worked with industry. So this applies to food manufacturers, restaurants, food service operations. It's really broad. They're trying to create a level playing field. I mean, of course, it's voluntary, so it all depends on who is going to actually volunteer to gradually lower sodium, but we hope that it happens. They do expect to have a revised targets in the next few years to facilitate a gradual iterative reduction in sodium. So just wrapping it up, so the launch, just giving you the timeline of Healthy People 2030, kind of bringing this full circle. So 2021 through 29, throughout the decade, they'll be releasing the Healthy People 2020 final report. So if you're interested in data and the goals, and if we've gone up or down, gotten better or worse, it's really interesting information if you check out the Healthy People website. They're going to be adding disparities data, state level data, demographic data for core objectives. They're going to add at least 2 data points for each core objective. They're going to conduct ongoing assessment. So it's a really interesting and very busy project. From 2028 to 2030, so at the end of the decade, that's when they start like over again developing Healthy People 2040, collecting all of the final 2030 data. So in summary, I'd already mentioned most of these, but these are the uses of Healthy People, really framework for local planning and development, setting local targets, using national data for goal setting, grant writing, etc. Oops, I skipped. And I think my biggest thing is, we're all in this together. We have a lot of work to do, to help make environments healthier, help our communities eat healthier. We all play a role. I think we all have like different roles in helping communities eat healthier and be healthier, but hopefully we can come together and make a difference. So if you want to connect with Healthy People, you can visit the website, health.gov/healthypeople, follow the Twitter handle at health.gov. And if you'd like to contact me, there's my email. And thank you so much.